Hi, my name is Tom Hardesty, and I'm the massage therapist here at the Zwiebel Center for Plastic Surgery. And with me is our lovely assistant, Penny. She's going to help me demonstrate craniosacral therapy, which is one of the techniques that I do both pre and post surgery on clients. The real benefit of craniosacral in this instance is the relaxation factor, but it can help with a number of physical ailments as well, both back, low back, pelvis, neck and head injuries, or just conditions like that. So what I'm going to do is demonstrate some holds on Penny while I describe what it is. Okay? The craniosacral system is, it consists of the bony structures in the head or the cranium all the way down to the sacrum, and that's where we get craniosacral from. It also includes the spine, and then within the spine the meninges, which are the tough fibrous membranes that surround the brain and spinal cord. The function of these meninges is to keep the cerebrospinal fluid surrounding the brain and spinal cord intact. That fluid cushions and nourishes the central nervous system of the brain and spinal cord. So in essence what we're doing with this technique is trying to find any kinks in the meninges or just places where tension is being held in the joints, and getting rid of that tension. That allows the flow of the cerebrospinal fluid to be optimal, and besides feeling good, it gives your body a real sense of relaxation as well. That is one of the most important things in the healing process, is getting the body to get out of the fight or flight or sympathetic nervous system into the rest and digest or sympathetic nervous system. So one of the basic holds that I do with craniosacral is I take my right hand and I go under the bone in the back of the skull called the occiput, and then this one goes under the lower back. And as you can tell, it's very non-invasive, and there's no movement involved. It's a static hold. So what I'm feeling for is the pulse or the rhythm, which is about 6 beats a minute. That's the mechanism that moves the cerebrospinal fluid around the brain and spinal cord. So I'll usually hold this for 2, 3, 4, 5 minutes, however long it takes, until I feel a sense of balance has come into play. So I'm going to speed that up here a little bit, and then show you one of the cranial holds as well. So after I'm done with this, I take one hand under the occiput, and the other hand goes over the frontal bone of the forehead. And this is where you really feel a sense of relaxation, because we're surrounding the brain as we do this. And you probably can't hear this on camera, but Penny's stomach is gurgling, and that is one of the biggest indicators of the rest and digest system coming into play. During fight or flight, all the energy goes to your arms and your legs so that you can run away or fight. During rest and digest, all the blood goes to your abdomen, and it helps your organs to heal themselves and to basically digest food, things like that, so rest and digest. And people always get embarrassed by the gurgling, but I tell them that's a compliment. It means that what I'm doing is working. So you may also notice my top hand is moving a little bit. What I liken this to is just the tension between all the bones in the skull coming out, releasing, and letting go. And normally, I'd say 9 out of 10 patients find this very beneficial, and they come off the table feeling very relaxed. In fact, sometimes I have to give them a couple of minutes to wake back up before I'm done. So basically, like I said, this is more relaxation than structural, but there is a structural benefit to it as well. So that's it for craniosacral therapy. And again, this is Tom Hardesty, and I'm the massage therapist here at the Zwiebel Center for Plastic Surgery.